Hello, good evening, everybody. I'm very glad to see so many people have shown up for this seminar or webinar, and very humbled by the number of people who have shown up. I will try to do justice to this topic. It is a very, very vast topic, very underrepresented topic, I would say, because not many people are actually aware of how severe the global burden of this disease is. So what I'd like to bring to your notice is how much global burden this disease has in the world and the potential or catastrophic potential of this disease as it progresses onwards to type 2 diabetes mellitus. I hope my screen is visible to everybody, the presentation screen. Okay, wonderful. So without any further ado, let me go into the topic proper. So the topic is pre-diabetes, how to delay the progression to diabetes. So firstly, before talking about pre-diabetes, we should understand what pre-diabetes is by definition. And by definition, it is known to be a component of metabolic syndrome, which itself consists of various diseases integrated into one subcategory of medicine, which includes a lot of problems such as obesity, type 2 diabetes, hypertension, dyslipidemia, obstructive sleep apnea, cardiovascular disease, cerebrovascular disease, etc. And the main disease proper follows around the fact that it is basically elevated blood sugars. However, the dictum says that it falls below the threshold of type 2 diabetes. So it is neither normal nor completely abnormal. It is like a gray area in between normal state and type 2 diabetes. Now the question arises, how do you find out whether you have pre-diabetes, diabetes, or you're a normal state? So thankfully, that part is a bit more easier it is more easily measured than otherwise. So the basic component of investigation includes seeing whether you have impaired glucose tolerance or whether you have impaired fasting tolerance, that is IGT or IFT, which in layman's terms means your sugars are high after the food or your sugars are high even before having food. In IFT, that is impaired fasting tolerance, your sugars are high before having food and then normalizes towards the second phase, that is after food, that is postprandial. And some committees, some associations do correlate with the HbA1c percentage. Some people say they don't, but for the benefit of the doubt, we will add this into our component. So what are the values that help you diagnose that you have pre-diabetes and diabetes mellitus? In this, there are two components, that is the fasting plasma glucose and the oral glucose tolerance test. Now, fasting plasma glucose means the sugar levels that are checked before having a meal. The most preferred time to do this is in the morning before your breakfast, and any level that is between 100 and 125 milligram per deciliter is considered as pre-diabetes. Anything more should be considered or may be considered as type 2 diabetes mellitus. On the other hand, on the oral glucose tolerance test, where you take a certain amount of glucose, the current recommendation by WHO, World Health Organization, suggests that to have 50 grams of oral glucose and 2 hours following which the sugars are checked at 1 hour interval, 2 hour interval, and the 30-minute interval. But the most reliable would be the 2 hour interval here. And here the sugars would be at or more than 140 milligram per deciliter all the way to just under 200. So these two investigations will suggest that you have pre-diabetes rather than diabetes. However, I should mention that there is a rider that a single isolated value cannot use for the same. And there has been a difference in consensus regarding how many of these reports should come positive or how many of your blood glucose values should go above the normal in order for you to be considered as a pre-diabetic person. The third part is the HbA1c, that is the glycated hemoglobin. That is the amount of sugars that are bound to the red blood cells in your blood system or the circulatory system in your body. And as a dictum, what the associations including ADA, etc., that is American Diabetic Association, do agree upon is that anything between 6 to 6.4% may be considered as pre-diabetes. And usually anything more than 6.4, that is 6.5 and above, usually goes under type 2 diabetes. So again, just taking a single value or a single subset of values may not be adequate. This may need to be tested again and again in order to reinforce the same. And always the clinical picture of what the patient is and what they have, what diseases, what their lifestyle is, all should be inculcated. It's not like just do one blood test and then somebody decides that you're a diabetic or not. It's the whole encompassed picture. So the question of the day is, why is this so important? Now, you would think, I am not diabetic. So why am I at risk for these problems? How am I at risk for anything? Once I become a diabetic, yes, I should be more careful. For the time being, I will continue my lifestyle. So why I would say this is a misrepresentation how to go about is because of the global burden of this disease. Pre-diabetes to diabetes is like the iceberg and tip of the iceberg. Diabetes, the huge global burden that Subneet has mentioned earlier, along with pre-diabetes, is just a fraction of the number of people who have this disease. There are so many people who fall under the radar, who check their sugars, or rather have not ever known to consider this fact and are underrepresented, underdiagnosed, and undertreated, wherein by these people go to various complications and disastrous outcomes. So just to give you some insight, so the WHO and the CDC have mentioned that the global prevalence of impaired glucose tolerance comes to around 7.3% of the complete adult population in the world. And this was in the year 2017, equivalent to nearly 350 million people. And the predictions is that by 2045, the prevalence will increase to 8.3%. Now, we would think, what difference does 1% make? However, the 8.3% comes to 587 million people. So nearly 150 to 190 million people increasing in that short span of time. So that is just to give you a perspective of how big this disease is. We might not see the whole picture unless we get all of the facts on the table. So like I mentioned, diabetes and pre-diabetes, tip of the iceberg and the rest of the iceberg. So again, the question arises, why is this so important? So the topic proper suggests the importance or the relevance of knowing whether you have pre-diabetes or not is because, first and most importantly, it can progress to diabetes mellitus. Diabetes mellitus, as all of us know, is an irreversible disease which has long-term implications and complications and will require lifetime therapy for the same. The second important part, rather the one that is under-evaluated or understood by the general population, is the high risk of development of atherosclerotic vascular disease. That is, in layman terms, the propensity of you developing a stroke and an attack. That is the easiest way to mention the same. So as diabetes, even pre-diabetes is making you prone to these two horrendous diseases, whereby you may have a lot of complications and it might affect your quality of life and your daily activities in life. And why I would like to emphasize the same about treatment or the prevention of this disease is because at this stage of the disease proper, it is reversible. So just to give you a quick backdrop, that is of a pathophysiology of the disease, the basic idea is that in pre-diabetes, what happens is your pancreas produces a hormone called insulin. Now, you just require so much amount of insulin for your body to function throughout the day to keep your sugars under control, not only to prevent it from going up, but also to prevent it from going down along with glucagon. So what happens is in pre-diabetes, the cells in your body become insulin resistant. That is, more amount of insulin is required for a certain amount of blood sugars to be controlled. And mind you, this is about all the cells in your body. So the response to the insulin becomes slow. So naturally, your pancreas produces more insulin, trying to make the cells respond to this. And this works for a certain amount of time. How much time? Some studies say for about 2 years, some say 5, some say 10, some say 20. But the gist of the matter is this only lasts for a certain amount of time, following which what happens is your pancreas can't keep up with the production of sugar, that is glucose in your body, and it breaks down. And when this mechanism breaks down is when you develop type 2 diabetes mellitus. So now that you know what happens inside your body, basically, now how do you know that you might be manifesting these symptoms, that you're actually having these issues? And mind you, not like you see in the table right here of symptoms, these things, many times they fall under the radar. You think it's because it's too hot, or because you're very tired, because of your lifestyle, because you have emotional problems in life. But if you look at the disease proper, most of the symptoms that are seen in diabetes mellitus manifest as early in prediabetes as well. That is, you may be always hungry. That is polyphagia. You might take a lot of food. You might have fatigue and lassitude, whereby you're always tired and unable to carry out with the daily activities in life. You might have increased thirst, that is polydipsia. You always require a lot of water, having more than 4.5 liters a day. And as a consequence, you have polyuria, that is you tend to urinate a lot of urine throughout the day, in the middle of the night, in inappropriate times sometimes, etc. It might make you nauseous. That might have to do with the high blood sugars or the consequences of having high blood sugars and the response to your other organs to the disease. You might have blurry vision. Now, this is a little tricky because earlier studies used to suggest that when you develop retinopathy, that is the nerves in your eyes get damaged because of mechanical or endocrinological insult. What happens is the damage in the nerves only occurs in type 2 diabetes, but recent studies have suggested otherwise, that this starts in pre-diabetes itself, but on a very small and reversible extent. Now, when you think about diabetes, the general picture that you get is of a big obese person who is eating a lot of junk food. Ironically, when you have pre-diabetes, you may also manifest with sudden weight loss. And this usually occurs due to high uncontrolled sugars, which cause your metabolism to kick in and work faster. Your body has to function with a higher metabolic rate than normal, and whereby you start losing a lot of weight. An unfortunate side effect of this, along with type 2 diabetes mellitus, is sexual problems. That is, it might be emotional problems, mood disorders, and physical disorders such as premature ejaculation, erectile dysfunction, low seminal count, infertility, etc. And the last and most dreaded, especially for surgeons or people working in the trauma department, is the slow healing of wounds, or the apparent slow resolution of a wound that is not getting repaired on time. It might be a small nick on your hand. It might be a thorn or prick on your foot while you were walking. And a normal person would expect to heal within a few hours or days. But in diabetic or pre-diabetic people, these wounds tend to heal a little late. Now, another question is, if you don't have symptoms proper, are there anything that can predispose you to develop pre-diabetes and subsequently diabetes? And the answer is yes, these are called risk factors. Family history, for example, if you have a sibling, a father, a mother, a first-degree relative who has type 2 diabetes or even pre-diabetes for that matter, you're predisposed. Central obesity, whereby the amount of belly fat that you have or the amount of fat that you have centered around your body is more towards the center of your body rather than your limbs, also predisposes you to prediabetes. Hypertension, a systolic of more than 150, that is the upper level of blood pressure, and the lower part, that is diastolic, of more than 90 can also predispose you to the same. Having high triglycerides in your lipid profile, a low high density cholesterol, what is known as the good cholesterol. Having high blood sugars, as we had mentioned earlier. Your ethnicity, if you're an African American, you're Asian American, you're from the Pacific American lands, or you're from the Far East, even the Asian subcontinent are at high disposition for this. Vascular diseases, people who smoke have a higher tendency to develop prediabetes, and people who have vascular diseases before, such as endocrine or rheumatological or immunological or vasokinetic disorders, also are predisposed to develop prediabetes, because as some of you may already know, diabetes, the primary etiopathogenesis, that is where it hits, is the blood vessels, from the smallest to the biggest. Gestational diabetes, this is where women in the childbearing age who are pregnant and throughout the trimesters of the pregnancy will have an elevated blood sugars from the 5th month of pregnancy. This, for most women who have gestational diabetes mellitus, known as GDM, they have normal blood sugar 6 months after the delivery. However, even if they do develop that, these people are known to eventually go into type 2 diabetes mellitus, that is overt type 2 diabetes mellitus. Nearly 40% of them may develop the same. A child, when born at 40 kilos, 4 kilos or more of birth weight, have a predisposition to develop prediabetes. That is, the process starts from birth itself. And lastly, and most importantly, I should mention, is the sedentary lifestyle. A human being if you have seen a picture in most of these channels, such as National Geographic and historian channels, you will always see the human being is standing. You must have seen the picture of the evolution. The human being is always standing, which it therein by suggests that the human being is not meant to sit or lie down throughout the day. We are bipedal animals who are meant to locomote or move throughout the day. So a sedentary lifestyle works against the natural history or mechanism of your body, and it will produce disastrous consequences. So why we brought this topic here is because it is reversible. And how? Now, you would think as an internist or a family physician, we are entitled to treat your disorder with medications. But therein, I would disagree strongly, because unlike type 2 diabetes, prediabetes is treated by lifestyle disorders, lifestyle changes, and your change in your habits and your diet rather than the medication. Somebody had put it up in the Q&A earlier that they're taking pioglitazone. Now, the thing is, American Diabetes Association, as of 2018, has suggested only metformin to be the drug of choice, and that too is under some discretion. So there are a few more things that dietitians or internists or family physicians suggest, or an endocrinologist suggests, rather than medication. These might seem like very, nominal things or very cliched things, but let me reassure you, 70 to 80% of people who develop prediabetes are completely reversible to a normal. That is, they can revert their sugars and the HbA1c and their lifestyle profile to a normal state just by changing some certain things. Overweight and obesity is one of those things. If you can reduce your weight even by a trifle little, it will change the scope of how you might progress in the type 2 diabetes. In fact, if you might have a U-turn in your disease process, you might take a full turn. A sedentary lifestyle is not natural for us human beings, despite the lifestyle that we live through. Increasing the amount of activity that you have in your life will change things drastically. And wherein by changing the first two things that I mentioned earlier will subsequently act upon the last two. That is, it will reduce the hyperlipidemia, dyslipidemia, that is the high lipid levels or abnormal lipid patterns in your blood, and the hypertension. Walking for 30 minutes in a day has been statistically known to reduce your blood pressures throughout the rest of the day by 10 millimeters of mercury. And that is no joke, even though it seems like just 10 millimeters. This fluctuation of 10 millimeters might be the difference in you developing a stroke or an attack and not developing it. So it's a big thing. Why prediabetes is so important? Because it's like a fork in the road of diabetes. That one fork in the road, if you are able to, finally make timely changes, you can go back to normalcy. However, if you don't and you proceed on that road of diabetes, there is no coming back. Diabetes is irreversible. So what can be done to prevent yourself from going into these issues? So the first thing that I can suggest to you is to have and eat healthy foods, that is having wholesome foods. The problem with certain foods, which we nominally call as junk foods, is that the density of carbohydrates in this food is really, really high. The problem is not in taking foods that are high calorie. The problem is taking foods that are not balanced. That is, an ideal food should have nearly 40% of carbs or carbohydrate, and the rest 60% or 50% of the food should be divided between protein and fat. Unfortunately, most of the so-called junk foods have somewhere between 60 to 90% of carbs, and the rest is fat and protein, and usually more fat rather than protein. The second thing that I would like to advocate here is the amount of exercise. Now, the question is, how much is enough? So American Diabetes Association, American Heart Association, European Society of Cardiology, all have suggested one thing, is to work out 30 minutes, 5 days a week, and that will change your life significantly. It is just a half an hour of your 24 hours, or rather 2.5 hours in your weekly life, which can change your life drastically. And by these 2.5 hours, it's not like you have to do a triathlon or swim multiple laps or do some HIIT, that is high intensity training. No, it is just plain walking, maybe at 5 kilometers an hour, or cycling for this half an hour, or doing light aerobics. That is all that your body requires. So what about weight? Now, when we think about weight loss, we would think we have to lose huge amounts of weight. You have to make some drastic changes, the keto diet, the modified keto diet, etc. Well, Let me surprise you there. Statistics have shown, or studies have shown, that in a 90 kilo individual, that is a 200-pound man, you just have to lose 10 to 15 pounds, that is just 5 to 7 kilos, and will reduce the incidence of developing cardiovascular disease and diabetes by 75%. That is 3/4 of the effort is done by just losing a measly 5 kilos if you're 90. That is just to show you how little loss of weight you require to save yourself from some horrible things. And the next two things are, if you have coexistent hypertension or dyslipidemia or hyperlipidemia, that is, cholesterol levels that are high, treating them adequately will again change around the subsequent consequences that we see. And the last important thing is, don't smoke, or rather reduce the incidence of your smoking. And it has been documented that nearly 30% of the disease proper in pre-diabetes compared to 70 or 80% in diabetes can be reduced or prevented or averted from having an attack or a stroke just by stopping smoking. It is as simple as that. Maybe not as simple in action, easier in principle, but still the effort does matter. So with that, I would like to conclude what I just discussed about. So throughout the discussion that we had, we have spoken about few things. That is, we defined pre-diabetes. What is the difference between pre-diabetes and diabetes? Why it is so important? What clinical features you expect, or what symptoms do you expect in the disease proper? What is the etiopathogenesis? That is how, why, and what does the disease do inside you? And then we talked about how do we prevent ourselves from falling into that trap. So I hope I have been able to keep this very concise and informative to you. Hopefully there is a take-home message that you may be imbibing in yourselves. And I'd like to put it as a note that, these things are not only for people who are pre-diabetic and diabetic. It is a gentle reminder to people who have normal lifestyles, but are having some certain physical issues or having other diseases, who can also inculcate this into their life proper. Thank you everyone for attending the session. I have been very happy. I am very humbled by being given an opportunity to present this topic. Thank you so much.